Hi everyone, this is going to be a teaching style video of the bony landmarks of the humerus. So today we're going to start with looking at the proximal part of our humerus. And here we have a tag, and it's going to be this whole structure here. And this is going to be called our head of the humerus. And then if we come a little lower, we can see this line here that goes all the way around the head of the humerus, and that's called our anatomical neck, and that's where this is pointing to. And we can see it go all the way around. And then if we come a little lower, we are going to be looking at this part of our humerus. And this is just going to be covering our surgical neck. Okay. And then if we come down lower, we can see these two bumps on the sides of our humerus. And first, as we are orienting ourselves, we have to know which side is medial or lateral, because these are going to be our medial and lateral epicondyles. So to know if we're medial or lateral, we're always going to be looking at this part of our humerus, and it's always going to sit medially because it's going to be sitting inside of our glenoid cavity of our scapula. So then to know which one's medial or lateral for the epicondyles down here, this one would be pointing to our medial epicondyle because our head is pointing also medially. And then this would make our lateral epicondyle. And our medial epicondyle is also going to be slightly bigger. And then if we come around to this side, we have this yellow tag right here. And this is going to be showing a line here, or a groove, that is kind of hard to find, but we're posterior on the humerus. And that's going to show our radial groove. And then if we come a little lower, we can see these two ridges here. And these are going to be our medial and our lateral supracondylar ridge. So here we can see our medial one because here's our medial epicondyle, and here would be our medial supracondylar ridge. And then if we come on this side, we can see our lateral supracondylar ridge. Okay, and then we have a couple more tags. So if we come back to our proximal humerus, we could see this structure here. And this is going to be our greater tubercle of the humerus. And this is always going to be lateral because our head is medial. And then if we come more anterior, we can see our lesser tubercle. And this is always going to be a great landmark to know if you have a right or a left, because this is always going to sit anterior, our lesser tubercle. And then in between our greater and our lesser tubercle, we have this intertubercular groove, or our bicipital groove, because this is where our biceps tendon will lie. And then if we also come more lateral onto our humerus, we can see this mark right here, and it's kind of a roughened surface, and this is called our deltoid tuberosity. So that's where these arrows are pointing to. And then if we come back down, we can see a couple more structures. So first I want to point out this structure here, and I'm just going to remove this tag, but I just wanted to have it there to show you where we're going to be looking. So it's going to be this bow tie structure, and this is going to be called our trochlea. And then on the other side, or more lateral to our trochlea, we are going to have this ball-like structure right here. And that's going to be our capitulum. So Our radius is going to be articulating with our capitulum, and with our trochlea will be articulating with our ulna. And now we have a couple different fossas. So first of all, above our trochlea, we're going to have this fossa right here. And this is going to be called our coronoid fossa of the humerus. And this is going to be attaching to our coronoid process of the ulna. And that's above the trochlea. And then, if we come over to the capitulum, this should have been moved up a little bit higher, but here we can see our radial fossa, where our radius will be attaching to when we flex our elbow up, or our elbow joint. So radial fossa is above the capitulum because the head of the radius is attaching to our capitulum. And then trochlea is, we are going to have our ulna attaching to the trochlea and coming into our coronoid fossa. And here's our radial fossa. And then if we come posterior, we have this big fossa here, and this is called our olecranon fossa. And this is where our olecranon process of our ulna will be attaching. And that is all of the bony landmarks of the humerus. Hopefully that was helpful.